My name is Julie. I started my career in France as a UX consultant. I worked on very different fields. And 4 years ago, I moved to Finland to work with Varian in the healthcare system. Varian is one of the biggest manufacturers of radiation therapy machines around the world, and also doing software for oncology hospitals and clinics around the world. I've been dedicating my time of the last 4 years to work on Nuna, which is a patient-facing application for cancer patients. So how to keep your growing product patient-centric? This is the story of how our design team went through from a qualitative user research process to a more quantitative and data-driven approach. So I would like to tell you today how we went through this qualitative process to this more quantitative approach, why we did that, and what were the impacts on our design process. All right, what I will be talking about first, I would like to give you a bit of context about what Nuna is and what it does, so that you understand a bit better our context. Then I will tell you about our initial patient-centric approach, how basically Nuna was built in the first place with the users. And then as the product grew and the patient user base grew, what challenges we faced and what we changed to answer those challenges. This had 4 different impacts on our design practices, and I will finish with one key learning. All right. So Nuna is a patient-facing application for cancer clinics and most of all their patients. As you know, going through a cancer treatment is a long and difficult journey. So Nuna was built to help the patients take a more active role in their care and feel supported when they need it the most. So what is Nuna in concrete words? Nuna is an electronic patient-reported outcome tool, but not only. It's most of all designed first with the patient's needs in mind. So the patients, it's not only about answering questionnaires to the clinic and providing data about their well-being and how they are feeling, but it's also like the main point of contact for the patient with their cancer clinics during their treatment and also during their follow-up phase. So the patients, for example, they can access their lab results through Nuna, they can see their appointments, and they can keep a personal diary about how they're feeling so that then they can talk about it better when they are seeing their doctor. There is another side of Nuna, that is Nuna for the physicians and the clinicians, which enables the clinic to monitor their patients, see how they're feeling, and communicate with them. We will focus on the patient side today. One important note maybe is that Nuna is integrated with the EMRs. So it enables it to be integrated more smoothly into the clinician journey and toolset. All right, as probably some of you know already, using patient-reported outcomes through cancer treatments, it has shown benefits for the patient outcomes and also for the clinic performance, like the clinic operational performance. So there are studies that show that using that type of tool will improve the survival rates of the patients and also keep them on treatment longer, which improves their outcome, and also improve the quality of life of the patient overall. For the clinic, it will also enable to lower the ER visits and relapses of the treatment, which will reduce the cost for the clinic. So it has benefits for the patient and for the clinics. And that's why more and more cancer clinics around the world adopt that kind of tool. What we can see here is more Nuna-specific data that shows that some symptoms were reported in Nuna. So using the mobile application, the patients were reporting those symptoms, and the clinics didn't know about those symptoms in the EMR, meaning that the patients were not reporting those when seeing the doctor. We see here the first in the list is anxiety, and we see basically that 86% of the patients were feeling anxiety. They were reporting it in Nuna, but they were not talking about it at the clinic. So Nuna was enabling the clinic to have a broader understanding of how the patient was feeling and what symptoms they were experiencing. So that brings also more knowledge about how the patient is living with the treatment and with the disease. This data is from one of our customers in Finland. The thing is, none of this can happen if the patients don't actively use Nuna. So it's not enough to just tell the patients, hey, we have this app, just install it. We also need to make sure that the patients are using it and actively using it and reporting how they're feeling, so that then they can have all the benefits that are tied to it. So that's our job, right? That's what designers are here for, to understand how the users can take the most benefit from our application, and then as a result, actively use the application. And that's the reason why Nuna was built with a patient-centric approach. So with this part, I would like to rewind a bit and tell you about, like, briefly how Nuna was built in the first place, as it started in 2014 in Finland. It's a very small team, a very small startup. And we'll see that then it grew, and I'll tell you more about this. So, first I want to tell you about the business to clinic patients model and the challenge that is tied to it. So what we do is that we are a team building Nuna, and Nuna is sold to the clinics, the cancer clinics, who are paying for Nuna, basically, like if I summarize it very, very simply. And then the clinics give this application to their patients. So it's not possible for someone to just go and install and use Nuna. They need to have a clinic that is providing the app for them. So the big challenge with this is that, well, the patients are not the ones who are basically buying Nuna. They are not paying for Nuna. Therefore, the question that you might be wondering is, how can we keep a link, like a direct link, with the patients in this type of context, since we are like one step away from them? So at first, Nuna was, as mentioned before, a very small scale team, a very small scale product, a startup, and it was built with a fully qualitative approach in Finland. It was designed with the patients, with the clinicians, the nurses, and the doctors in Finland, with a very close partnership with one hospital in Helsinki. So basically the team, the founders, they spent very, very much time in the Helsinki hospital, working with them, observing how they are working, and discussing with the patients about how they could improve their experience during the cancer treatment. For example, what you can see here is one of the workshops with breast cancer patients, where like it was a full workshop with, I think, around 40 different patients who were here to give their opinion about what they thought about the first version of Nuna and how it could be improved. But what happened next is that it worked a bit too well, if I can say. As today, Nuna is used in more than 140 oncology clinics around the world in different continents. Overall, more than 120,000 patients have used Nuna, and we have 12 different languages available in the application. So that's a very good problem to have, but it has challenges that I will detail next. So what challenges did we face for user research in that type of context with this growing and fastly growing patient user base? 3 challenges. The first one is that having this direct interaction with the patients that we had at the beginning became more difficult for various reasons, such as the clinics being protective of their patients, thinking that we don't want to bother the patients with that. They have a life to live, and they don't want to think about that. Like, we just don't want to bother them. We didn't have, with all our customers, this close partnership that we had with the Helsinki hospital at first. So having this direct interaction with the patients became more difficult. We were already collecting usage data, but it was difficult to access because we didn't have the infrastructure that was needed to access the data in an anonymous and respecting the privacy of patients. And last but not least, we had a Finland bias due to the fact that the first version of the product was built in close partnership with a Finnish hospital, with Finnish patients. And as you saw in the last slide, we now have customers and patients using Nuna in different continents. And for example, in the US, there is a very different clinical workflows, very different financial contexts, and the patients have different needs. So we were still seeing things with this like Finnish scope of user research, but we knew, like, we kind of had no idea about the needs with our product for the US customers, for example. We could summarize it like this. So you might recognize Plato's cave here. So it's a bit like the philosophical slide of the talk. We were, as designers, we were only seeing what the clinics were saying the patients user do and need. And that's a bit what was said during the last talk, with this difference between the findings of the user research with the patients and what the clinicians thought was important for the patients. And what we were seeing is only what our customers were telling us. While what we wanted to do is to go out in the wild and see and talk and interact directly with the patients. And by the way, patients are not only patients, they are humans. They have a life also outside of the hospital, and they are probably needs that cannot be seen by the clinician. This is especially true for cancer because when you have a cancer that's a chronic disease, and you are following a treatment that is a long treatment, yes, but you don't spend your whole time in the hospital. You will go to the hospital for your treatment. For example, if you're on chemotherapy, you will maybe go there once a month. But all the other time that you spend at home, this is kind of not seen by the clinician. And that's still part of your cancer journey. And as you understood before, Nuna is meant to be used at home and not at the hospital. So it was a bit like designing in the dark, and we wanted to change that. So what did we change? The first thing we did is that we invested in new tooling for us to be able to track data more efficiently about how the patients are using the application. Those are the two main tools that really impacted the most our design process. There is Pendo, which is a tool that enables us to track the usage data, like basically what pages people go to and what they click on. And that's a tool that is really thought and designed to be used by designers. And Dynatrace is the tool that we use to track what's happening in our backend, meaning that what API calls are made and measuring the performance of our application. So like how long do the pages take to load and so on. Today, I will focus mostly on Pendo because that's the tool that impacted the most our design process. And I will detail in the next slides in very specific ways what we are able to do thanks to those tools. Thank you. All right. The first very straightforward thing is that we are able to create ourselves flexible charts of aggregated usage data. So we are able to follow how much a feature is used by patients and build funnels of our different user flows, such as, okay, a patient is answering a questionnaire in Nuna, where are the patients dropping off this funnel? The strength of that is that we are able to create segments and see, for example, the data that is clinic per clinic. So we are able to evaluate how Nuna is used in our different customers or different geographical area. I will talk a bit more about this later. If we go in very much more details, we are also able to see what one user does in the application. What you can see here is the timeline of what one patient did on one day. On the top, you can see the rectangles, which are what pages has been visited, and the dots that you can see under it are what clicks they did, so what elements they clicked in our application. This data is entirely anonymized, so we are not storing PHI in Pendo, and we are still able to see that kind of detail, which makes us very much more aware of what the patients are doing. We are also able to see that data when someone provides us feedback. We're able to analyze, okay, I don't know, the patient said that the lab results feature is not working. So we are going to see, okay, how are they using this feature exactly? And all of this is made in an anonymized way. Another thing is that thanks to Pendo, we are able to display messages inside the application. And those messages, such as this pop-up, is not coming from our code base. So it's coming and generated entirely from the tool. And we are able to target very specific population of patients thanks to the tool. So here, basically, we are able to trigger this message to the patients that have a usage that is interesting to us, and we want to talk to them. So thanks to this, the patients, they can sign up to our user research interviews and provide us with their contact details if they want to participate. And this is without us sending them any email. It's really displayed inside the application. That made us, that is kind of solving our issue of not having a direct access to patients and having this like clinic layer between us and the patients, because we are basically communicating directly inside the application with the patients. This similar way, we are able to display feedback surveys and net promoter score survey inside the application directly. So we collect the very detailed net promoter score feedback, and we are able to build dashboards that are like we can basically analyze this feedback against any metadata that we collect in Pendo. It can be the customer, it can be, for example, the birth year of the patient. We are able to analyze this kind of feedback very deep without without any additional effort, basically. And lastly, Pendo enables us also to improve the patient experience in the application in a very easy way. Here, what you can see is examples of guidance that we built for the patients, depending on their feedback and on the navigations that we were seeing thanks to those analytics data. So with Pendo, we use this analytics tool basically to create customized onboarding for the patients, depending on the features that were available in the applications for them, and also depending on their early steps in the application. What you can see on the right is a message that we would only display to a patient if they would not use the messaging feature of the application after 2 months. We want to make sure that they are aware this exists, and that they just if they missed it at the beginning, then we remind them that this exists, and they can use it to contact their clinic if they want to. All of this had 4 major impacts on our design practice. The first one is that since we started using this tool, which we started using around 1.5 years ago, by the way, we now include quantitative research in the first step of our design projects and new initiatives. And that has become like a normal daily life of the team. So the first thing we would do with a new initiative is that we would dig into the data we have and try to find insights from them. Then those insights would be discussed in the team, and we would define, okay, what does the success like for this redesign, for example? If we want to redesign the messaging screen of the application, what exactly do we want to improve in our analytics? And we would define that ahead of the project so that then we can measure our success later on and also be able to iterate on it. Secondly, we don't only do data analysis now, we keep the qualitative research work and we make those two work together. And it goes both ways. Firstly, we are, for example, able to go from what do the users do, and then analyze why they do so by using qualitative research. For example, I think around a year ago, we noticed that part of our users, as I mentioned before, never send any message to their clinic. And that was a surprise for us because we were expecting that was the main feature to use in Nuna, and that's what our customer success managers were saying, that that's really the key feature of Nuna. So how so we have this large part of patients not using this feature? And we could make assumptions such as, okay, is it because they don't need to send any message to their clinics? They don't need to contact them? Or is it because they just prefer to use the phone and call their clinic? Or is it because they don't know about the feature? So what we did is that we ran interviews with patients using this in-app sign-up feature that I showed before. And we found out that some of the patients, they just have a poor understanding of what Nuna was doing and what it was here for. Because, for example, we didn't have a good hand on how Nuna was presented to them. And that's the reason why we started this initiative of having a patient onboarding in the application to make sure all the patients are onboarded to Nuna the same way and that they know about the features that are available to them. The other way around, we are able to go from what data and what insights we collect during interviews, basically what do the users say, and then identify in the data if that is something that a bigger proportion of the patients is experiencing. Because, well, as mentioned in a previous talk, the number of patients you are talking to during interviews is sometimes very low. And this enables us to confirm some insights with the patients. So, for example, we would hear in some qualitative feedback or interviews that some patients have problems with their password. And we don't know if that's something that, okay, is it because they don't remember their password, or is it because there is some problem with the flow that is enabling them to reset their password? So we would then check in the data, okay, is it something that a lot of patients are experiencing? Are they asking to reset their password very often? And then we would put those data in basically together to find out, okay, is there a problem with the reset password flow, or is it something else? Third point, we make decisions faster to improve the user experience. Basically, before, when we were releasing something new, that was it, like we were going to do something else. And now what we're able to do is monitor how people are using those new features that we are releasing, and then be able to improve it after the first release. So have this more iterative process in the design. Here, that's an example of how we did this very quickly using one of those guidance items that we built in our analytics tool. And basically what we found out after releasing this message is that most of the patients, like 83%, were clicking the close button on this message. And that was not our goal. We wanted them to go through this flow that was enabling them to understand better how they can report a symptom. What we were able to do is just to change what is written in this call to action button and then observe if it had any impact. And yes, it had quite a big impact. Sorry, yes. Just by changing this call to action from add a symptom to continue, then we were making the patients click on this button. And well, we didn't have any qualitative research around that, but the assumption we have is that when calling this call to action add a symptom, we were excluding everyone who didn't have any symptom at the moment and were not needing this feature. But what we wanted is for them to be aware that this exists in the future. So by changing that to continue, then the patients were going through this onboarding flow more easily. Last thing is that I think that's the most important, like we really understand all our user base better. Here you have an example of the features that are used by the patients in three of our different customers. And Nuna can be used in very different ways by our customers because the clinic workflows are very different, and not all the features are enabled for all the clinics. The impact is that the patients, they basically have a very different experience from one customer to the other, as you can see on the screen. One color represents one feature of our application. So in Clinic A, you can see that the red feature is the one that is mostly used by the patients. But in the Clinic C, it's not available to the patients. So they are not using it, and they have a very different experience with Nuna. This is something we would not have been able to see if we would not have been able to segment this data customer by customer. We would just see an average data, which would not give us precise enough insights. Also, the fact that we understand all our user base better enables us to have more meaningful discussions inside the team when we discuss new features or what we should do with the product. I saw someone laugh. I think that's something you probably have heard before, that, yeah, it's good, you do a digital product, but, well, our cancer patients, they are so old, they would never engage with that. So what's the point? What we did is that we went into the data and we went to compare, okay, does the age of the patient have any impact with their NPS score, satisfaction, or the amount of time they spend into our application? And we found out that there was no significant correlation between Nuna's usage and the satisfaction and the age of the patient. So that doesn't mean that the previous statement isn't true in general, but at least in our application, we see that whether you are 80 or 40, there is no major impact on how much you will adopt the tool. I would like to finish with one key learning that is a bit less about data, but more about how to handle this internally inside our team. It's been a year and a half that we started using that kind of data, and it has been a very progressive, step-by-step process. It's not just one day you get data and you're able to do all those things. What we did first is that only the design team, we really led this initiative internally. And once we got all this data and access to this tool and the ability to do all those things, it was not enough. The one thing that was really key in changing all of this in our design process was to collaborate with the other teams inside the organization. And I know if you have worked with data before, but everyone is interested in data and, oh, you have data, I want to see the data. What can I say to my customers? And also the customers want to see the data. There are several challenges to that. The first is that data is not always straightforward to understand. You need basically to train everyone to be able to interpret the data the right way and not make false assumptions about what they're seeing. So it went very progressive that first, basically we extended the scope of who was accessing the data step by step. And today we have several teams really autonomously using this data. And the fact that those teams with different point of views have access to this data, we are able to discuss it in a very rich way. For example, when we see that there is something happening or some specific feedback that is negative about one customer, we would discuss with the customer success teams to understand, okay, what is the reason that might explain this negative feedback about this precise customer? Is it something that relates to design? Is it something else? We invested a lot of time in this internal kind of democratization of the data. And that, like, there are very concrete steps that you could take, such as talk about the data internally, have that kind of monthly meeting when you share insights that you have analyzed before and not just showing pure data to people. And also involving more people in being able to manipulate the tool so that then you can discuss this and make them autonomous. Otherwise, you don't do design anymore, you just do data analysis, and that's something that I wanted to avoid. So today, this data-driven mindset is well anchored in our team's culture, and that has changed like completely the way we see our patients and the way we are able to do user research. Thank you so much. Any question?
I've got one. So once it wasn't the main part of your speech, but that got me very interested. What was the team's reaction for the deeper and tighter cooperation regarding data? Were they annoyed that someone was trying to steal their ideas and approaches, or were they eager to cooperate really and to get something more from the same data they were working on?
This type of data, we didn't have that specific data internally. What we had was basically data that was in our database, but it was much more difficult to access because of all the medical regulations. So the reaction of people was basically to say, okay, I hear data, I want to see this meeting, I want to talk with this person because I want to access the data. Then the challenge was to make people able to get data themselves without you to basically answer everyone's requests all the time. Because even though this tool that I mentioned, Pendo, is very user-friendly, it's still like a technical tool that we set up. And depending on how the data points are named, it can be understood differently by people. So there is this really like collaboration aspect that's very important. But there was not at all negative reactions internally.
I will have two questions. The first one is actually how often it happens that you're surprised with this data insights, that you made some wrong assumptions maybe. Are you surprised often? And the second question is you were mentioning at the beginning that you had this Finnish bias. I wonder what out of this data, have you spotted any major difference between the Finland people behavior and the rest of the world?
Mm-hmm.
Thank you.
Especially at the beginning when we suddenly opened the door and got overwhelmed with data, there was a big surprise regarding what part of patients are using what features. Because as mentioned, we were just assuming that because everyone said this was the key feature and that was the key feature to sell Nuna to customers, then the patients were using it the most. And that was not actually the case. And it can also be, for example, that the patients are in the follow-up phase with the hospital and they just don't want to hear about their care team anymore because they are feeling well. And we were talking about this yesterday during the workshops. So that was the first surprise, and that was that made our product management go back to earth, if I can say. And then we tried to understand why and to improve this data. Nowadays, I would not say it's a surprise, but it's more like a curiosity that when we release a new feature, we want to know, and everyone wants to know, okay, how many users are using it and in what way. So that's not really surprising anymore. For your second question about the difference between Finnish patients and the other patients, I don't know if you know a bit about Finland. It's people that are like generally, if I want to make a generality, they like to follow the rules and what they are told to do. And also because the customers were in so much close partnership, and like the first customers of Nuna, they implemented Nuna in like the perfect way. That means that the patients, they were using Nuna in an almost perfect way, like responding to all the questionnaires and reporting all their symptoms. In the US, for example, the features that I use the most is the features that are passive, like just, I want to see my lab results. I want to see my medical records. And people are not that active in the application because also the clinics have very much different ways of working with the patients in the US. So just depending, for example, about when in the patient journey, the clinic would send a questionnaire, you would have a different effect on the response rate that your patient gives. You can have questionnaires that are sent to prepare for an appointment, for example, and you can have questionnaires that are sent after the appointment to check how you're feeling after your treatment. And this has like impact about how the patient is using the application.
Thank you.
Sure.
Hi, Julie. Thanks. I'm curious to understand how you arrive at that call to action change. Like, I noticed that the click conversion is actually very high when you change from had symptoms to continue. How did you discover the actual problem with users not interacting with that particular feature?
It's really, if we wouldn't have the ability to change the text easily without going through a whole release process, we would not have done it because that would be too much effort. But with this tool that was enabling us to show messages inside the application, basically just by changing the text in a UI, in a web-based application, and be able to change it just like that, then we just thought, okay, let's try to change it and let's see what it does. So there was no like long research process about, okay, how should we change this wording? We just tried it. We were also working with a content writer who like we just discussed with her and thought, okay, the assumption that I mentioned before maybe is just that the patients assume that they will add a symptom when they click there, while it's not really the case. We just want to show them how to do it. So it's just a matter of like test and learn. Yeah, we got the data afterwards. I mean, if it would not have worked, we would have tried something else.
Yeah, exactly. It worked.
I have a question. In the entire team, who was the decision maker to help convince you guys to use Pendo?
I was the one who researched what tool we could use, just because we got tired of not having direct access to our different patient populations. And I built a business case internally that I presented to our product management. And basically it's product management who got the budget to get the tool. And we got, I think it was a pilot phase of, I don't remember if it was 6 months or 1 year, but basically the budget is renewed every year. And well, no one is asking me anymore to justify for it because we involve now enough people across the different teams to like basically this tool has become a daily life of the team.
Julie, I have a follow-up to that question, and just to support. When you made this investment in tooling, I mean, it's so fascinating. Data is amazing, and what you can do with it. Do you have any, or can you share any insight around the investment that you had to make internally around upskilling your team to actually use the tools and extract the maximum value? So I think data is such a huge thing.
and the amount of people that can deal with it, process it, and effectively get to a solution is not always there. I just wanted to hear how you guys as a team dealt with that.
Mhm. Well, I don't think I'm able to talk about any purchase. It's a tool for sure that's not free. That required the business case to be okay, how much this will cost and what we are hoping to get from it. Then the design team really led the implementation of this new tool, meaning that we were the main point of contact, and I'm still the main point of contact when people have needs around the tool, but I try to make people more autonomous. For example, able to create dashboards themselves, and in each team to have like a representative who is more knowledgeable about the tool and able to answer their own team's requests. I didn't measure how much time I spent on it, but significant amount of time, which I think was well invested. I hope that's answering the question. Thank you.
You mentioned that you made a business case. Are you able to share what kind of information is good to share with the product manager to try and convince them of something like this?
What they are after is really how much that will cost. And then, well, yeah, right? Well, you're laughing, I think you know what I mean. What we will get from it, what is the tool able to do, and what problem it's solving. So we basically started from the problem that I described at the beginning, that we have no idea what's going on and how people are using our product. And we see, we had access to some data and we had some bad KPIs that we wanted to improve. And that was a way that we proposed to be just more knowledgeable about our patients. And by the way, we also see data about the use in the clinic side, even though I didn't mention it. And this ability to use the data to then target people with messages or surveys was also key, because it's not just an analytics tool. We already had analytics tool. They were just not user-friendly and made for people to dig into user insights, because we had, for example, Google Analytics at the time. But Google Analytics was not implemented in a way that was enabling us to track new things easily, for example, or building new dashboards easily. With this tool, Pendle, it's really easy for anyone to go in and without any data analysis training to be able to see very simple data and very simple KPIs. Another thing that I just thought about is that with Pendle, it's different from tools such as Google Analytics, because we are able to track new clicks on new elements without asking for developers to add them into the code. And that was a big difference. At the time, our roadmap was completely full, like 100% full for the next 6 months. And we had to find a tool that was not asking the developers to do more things. And that was the key for the business case, is that the promise was to have a new tool that would provide us data without any developer effort from the developer. There was still a bit of effort initially to install the tool, but now it's like I can go in Pendle and go say, okay, I want to track the clicks on this button, and then I see the data retroactively about how many people have clicked it in the last 3 months and from what customers and so on.
Thank you very much. This has been so useful.
Thank you.
Okay, Julie, I think there's a few questions from the virtual room. I'm going to try and feed that through to you, and if I don't represent the question properly, please unmute and ask again. But the first one was, how do you make patients engage with the solution or app when they think that they don't have any symptoms, and they go on to clarify? For example, cancer could be there way before people start to feel symptoms. So how do you monitor it? Regular checks need to be done. Does the solution also help to prevent or catch it at an early stage?
Right, I have many responses to this question. That's very true that typically when we have the patient onboarding to the application, then potentially they have not started their treatment yet, so they feel just okay. And what is interesting for the clinic is to track the side effects of the treatment. So that's the reason why it's not enough to show to the patients the feature that they should use in Nuna at this first use step, but also to check later in time, are they reporting symptoms? Are they contacting their clinics? And if not, then we can give a reminder shot to them that we remind you that you can do this in Nuna, and that's how it's useful to your care team and to you. Then it's really about how the clinic is implementing the tool. So when they are sending questionnaires to the patients, meaning when they are interested to know about the condition of the patient. And then Nuna is able to define the questions that are asked to the patient depending on their disease and their treatment type. So the clinic is implementing Nuna in a way that we have pre-made modules that say, okay, if I simplify it very, very much, this patient has breast cancer and is undergoing chemotherapy for it. So we want to ask about this, and this symptom, because that's the ones that the clinics want to track to know how the patient is going and how, like, if there is any intervention needed for this patient. So that's the way we make it so that the clinic, like, we make sure the clinic is getting the right level of information they need. And of course, then the patient, if they are experiencing anything else, they can go into the app and report it freely. This will also be transmitted to the clinic, and some alerts are basically triggered if there is anything acute that's happening for the patient, depending on their condition.
Thank you. So there's a few more. I'll be very fast. There's two more. The first one is Pendo similar to Mixed Panel? And related to that, does it track data for long periods, such as 6 months, or is there a limit to how you can access data? And do you want to answer that one first? Yeah, go for it.
If I go very fast, yes, we have access to the historical data from the moment that the element was visible in our application. So when we create a new page in the application, then we can right away see the data. And for example, today I'm still able to see the data from beginning last year when we started collecting it.
And then one last one, how effective would you say are the prompts for patients to share contact information for further research? Is there a lot of responses to the pop-up?
I don't have in mind the response rate of this guide. Yeah, I don't have in mind the response rate. Of course, it's not a majority of patients who are interested in doing that. What we do is that it will be prompted regularly, like not too much, because we don't want to bother the patients with it, and we have not gotten any feedback about those type of pop-ups being bothering the patients. I think we got more than 100 different contacts so far, and that has helped us very much to set up interviews with patients. We feel really much more confident that we will be able to do user research when we have a new topic now.
Great. Thank you, Julie. I think that's it from the virtual room. If there was any other questions, we can just I'll send that over to you. Thanks again.